Good afternoon, everyone. It's Dr. McQuillan from Berkshire Menopause Clinic. So today I'm going to be talking about when do you need a cervical screening test done. And this includes in those people who may think they don't need one because they've had a hysterectomy. So let's go. So cervical screening in the UK is offered to anyone between the age of 25 and 65. When you are 25 to 50, you will be offered screening every 3 years routinely, and over the age of 50 to the age of 65 every 5 years. Now this can vary depending on once you've had your cervical screening if any abnormalities are found, and please do see my other video where I discuss when you get your results, what do they mean. Now these are the routine reasons that you will be called for screening. If you have had a hysterectomy, do you still need screening tests? And this is a really important thing to know about your hysterectomy and what type of hysterectomy you have. If you have had a total hysterectomy, this means that you have had your womb and your cervix removed, then you are unlikely to need a follow-up cervical screening continuing on, unless, this is really important, if the reason you had that hysterectomy was because of cervical cancer or abnormal cells, you may still be offered a volt smear test. And what that means is that your vaginal volt will still be remaining, your vagina will still be there, it will be closed up because you will have had your cervix and your uterus taken away, so they will still take cells from the top of the vagina, because sometimes where the cervix and vagina overlap, there may be some cells remaining, and they want to make sure that that is not missed. So that is where, even in a total hysterectomy, you may be still eligible to have your cervical screening. Now, the other thing to really realise is when you are offered a total hysterectomy, please find out and empower yourself whether or not that still happened at the time of the operation. So for example, if a surgeon goes in with the view to do a total hysterectomy, removing your uterus and your cervix, but then there are lots of scar tissue, your bladder and bowel may be nearby, it's quite difficult to remove everything. What they intended to do may not be actually what happened, and some of your cervical tissue may be left behind. And that's why it's important you are really debriefed after your operation and you have a good understanding what happened and whether or not all of your cervical tissue has been removed. Because of course, if it hasn't in reality to what you were told or counselled was going to happen, you will still need to continue to have your cervical screening. The other way you may need to have your cervical screening after hysterectomy is if you were planned to have a subtotal hysterectomy. What a subtotal hysterectomy means is that your uterus is removed, but your cervix is going to continue to remain. And of course, you will need to continue to have your cervical screening test done. So I hope that helps. In summary, this is when to get your routine or after an operation. And if you want to know when you will need continuing cervical screening more often, in those where the results are given to you and you may be a higher risk, please watch that video. And then you may be at higher risk, for example, some conditions, things like HIV. And again, you may have to have more frequent testing then as well. I hope that was helpful. Take care.